Yes.
Bismillahirrahmanirrahim.
Yeah.
Dr. Raiha Afshi is a passionate Unani global worker, an enthusiastic professional for the promotion of Unani Tibb worldwide. Dr. Raiha has more than a decade of extensive experience in the field of Unani Tibb, striving as an ambassador to promote the true path of Unani Tibb globally. She's skilled in Islamic medicine, Tibb-e-Nabwi, hijama, cupping, and healthcare management. Dr. Reha has conducted 100 plus training sessions for Unani practitioners. She has participated as lead Unani supervisor for national and international webinars, and Dr. Reha is the co-founder of UnaniGlobalLead.com. Dr. Reha, the floor is yours.
Okay. Bismillahirrahmanirrahim. Assalamu alaikum, everyone.
Walaikum assalam wa barakatuh.
Hope you all are doing well. Wherever the art of medicine is loved, there is also a love of humanity. A very well said quote by Hippocrates. This is a very noble profession, teaching you to love humanity. Don't run for the money. Just treat the patients with love and care, and the money will follow you. Did you ever notice that most of the terms in the field of medicine are of Greek origin? To name a few: psoriasis, leukoderma, eczema, cholera, gonorrhea, leprosy, etc. These all terms are of Greek origin. Why mostly Greek or Unani? Yes, it is very important to know about the Greek or Unani medicine when you talk about medicine. The story of medicine can't be completed without taking the name of Unani medicine. Unani is the Arabic name of Greek medicine. Unani medicine is the need of today and also the solution to mankind. It provides a cure to many diseases which are nowadays considered incurable because it cures the root cause of the diseases, not just the symptomatic treatment. The most common example which I can give you is the treatment of COVID-19. We are thankful to our Indian government for their trust and encouragement towards the Unani system in the peak period of COVID-19. Our people are benefited a lot by our pathy. I believe that most of you present here are herbalists. I would like to present before you a brief history of medicine, just to make you feel motivated, because only a motivated person has the ability to bring a change in this world. Always remember your identity, because your identity is something on which you can feel proud. Before starting my narration, I must admit that this is nothing new, but just a quick revision of what you already know. Due to the busy lifestyle, some people might lose touch. So for a quick revision, let's become a student again for some time. Now, beginning with the starting of knowledge. The first thing regarding knowledge is philosophy, which is a Greek word which means love of wisdom or knowledge. Greek philosopher Thales is considered to be the world's first philosopher who has given a new dimension of thinking. He started raising questions about why things are happening and trying to find a rational answer with a belief that all events can be explained in natural terms that can be understood by humans. He is also considered as father of science. From there, attempts were made to identify the causes for everything, including illnesses, and this led to a move away from superstition towards scientific inquiry. Before that, The people deviate towards superstitions, and the illness was regarded as a divine punishment. But in continuation, the world was benefited from three great Unani philosophers and physicians named Plato, Socrates, and Aristotle, who did a lot of work in different fields. Great doctors also started to look at the issue of poor health and disease by using a process of reasoning and observation. The most recognized among them was Hippocrates, a Greek physician who is one of the outstanding figures in the history of medicine. He's considered as the father of medicine because in his books, which are more than 70 in number, he described in a scientific manner many diseases and their treatments after detailed observation. One of the famous aphorisms of Hippocrates is, physician must convert or insert wisdom to medicine and medicine to wisdom. In this regard, I would humbly want to say, study, 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 and don't try to treat people unless you have a deep knowledge about it. The first philosopher Thales, he once said, the most difficult thing in life is to know yourself. This quote easily fits every individual. Today, I would like to give this message to my Unani fraternity or the herbalist groups in any part of the world, that please try to know yourselves, and for that, you need to know your remarkable history. You ruled this world for centuries, and you still have the potential to shine again. Somebody truly said that don't hide your light. Let it shine. Now, coming back to the topic again, let's know about further development in the field of medicine in Greece. Another Unani scholar and philosopher, Theophrastus, known as father of botany, wrote many books, including the 10-volume set Historia Plantera. He was a student of Aristotle, the Greek philosopher and scientist, and is probably deemed as one of the earliest founders of botanical research. Later on in the 1st century AD, the first known copies of De Materia Medica, means on medical material, were produced, translated into Latin and Arabic both, thus making a way of the Greek knowledge to the outside world. This was written by a Greek physician called Pedanius Dioscorides. In this illustrated book, he covered 600 plants with around 1,000 medicines made from them. It was widely read for thousands of years and was regarded as a pharmaceutical Bible for those in practice, becoming the most influential work on medicinal plants in both Christian and Islamic cultures. Imagine, pharmaceutical Bible. A copy of the illustrated manuscript dating back to the 6th century is still in existence present in Istanbul, Turkey. Wait, just a minute. My slide. Sorry. Close my slide. Sorry for that. Sorry for the disturbance. Okay. Now I'm going to tell you an interesting story that how this medicine spreads to the whole world. Through the conquests of Alexander the Great, king of the ancient Greek kingdom of Macedonia, who was a student of Aristotle, Greek medicine spread far and wide throughout the entire Mediterranean world and beyond. He conquered the Eastern Mediterranean, Egypt, the Middle East, and parts of Asia during his 13-year reign as the king of Macedonia. Alexander founded the city of Alexandria in present-day Egypt, where an important medical school was established called the Empirical School in 330 BCE, making this city a great center of Greek science, medicine, and learning. The school attracted the best physicians and medical scholars from Greece and became influential in the transmission of Greek medicine to Rome after the Roman conquest of Egypt. Through Alexander's conquests, all the Arab, Turkish, and Persian peoples of the Middle East were exposed to the teachings of Greek medicine. This probably led them to take over Greek medicine in the name of Unani medicine later on after the decline and fall of the Roman Empire. Isn't it an interesting story? Let me proceed further. Next slide. Okay. So another important, here you can see another important personality in the history of Greek medicine. He can never be avoided. His name is Galen of Pergamon, who was a prominent Greek physician whose theories dominated Western medical science for over a millennium. Galen followed Hippocratic theory of the four humors with the belief that one's health depends on the balance between the four main fluids of the body. Galen was famous for his anatomical knowledge, which he gained through studying animal dissections, as the dissection of human corpses were prohibited at that time. By the animal anatomy findings, he developed a theory of human anatomy. Galen's anatomical reports on the nervous system of animals and their vocal cords were revolutionary. He believed that anatomy is the foundation of all medicine, and its knowledge is a prerequisite for every medical practitioner. We all accept this unanimously. He is truly called the father of modern anatomy. He published hundreds of works that not only influenced Roman and Greek doctors, but also the doctors in the Byzantine and Muslim courts. We understand how important anatomy is for medical students. Obviously, a good doctor is one who understands anatomy well. I can remember a very good reputed physician from my native place, Lucknow, India. He was a professor of anatomy and has gained a very good reputation and respect as a physician. I think you might have similar stories too. Next slide. Now, coming to a very important phase of the medicinal history, after which the Greek medicine got a new name, the Greco-Arab medicine. This is the Islamic Golden Age, and this period is considered as a bridge between the ancient and the modern worlds. The world has seen a revolutionary development in the field of medicine during this age. While Europe was in the so-called Dark Ages, Islamic physicians and scholars were elaborating on the work of the Greeks and the Romans. Translation and assimilation of the ancient Greek medical literature were done in Arabic, and impressive developments and new findings were added to it, which later influenced medical education and practice in Europe. Next slide. Okay. This period is given the word some very great medical thinkers who made advances in different medical fields, including surgery. We should be thankful to the physicians of the Golden Age. Without their contributions, we could not have saved the treasure of our Greek physicians. The scholars of the Golden Age also contributed a lot to this field. The comprehensive book on materia medica and foodstuffs written by Ibn al-Battar was the most famous manual of that time, in which he recorded around 1,400 herbs alphabetically. Other important scholars of the Golden Age were Zakaria Razi or Rhazes, Ibn Sina or Avicenna, Ibn Haytham or Al-Hazan, Abul Qasim Zahrawi or Albuquerque, and many more. Unani or herbal medicine will be incomplete without their names. Here you can see, I think you might be knowing that Reza Zakaria Razi was the first to distinguish measles from smallpox. And he has given this detail in his book, Kitab al-Jadrib al-Hasba. And about Ibn Sina, we all know that he was known as the prince of physicians, and he differentiated meningitis from other neurological diseases. And his book, The Canon of Medicine, it served as an encyclopedia of medicine for over a period of 600 years in the Middle East and Europe. Ibn al-Haytham, again, he's also from the golden age of Islamic golden age. He has given a detailed description of anatomy of eyes and also explained theories about the formation of images. He is known as the father of optics. And also, Zahrawi invented a number of instruments and surgical procedures. Now, around the 10th to 12th century, medical schools were established all over Europe, where all the medical literature of Hippocrates, or Bukrat, Galen or Jalinus, Averroes, or Ibn Rushd, Rhazes or Zakaria Razi, Avicenna or Ibn Sina, etc., were translated into Latin and used as texts in the medical schools. From around the 16th century, further development in the field of medicine started, leading to the formation of the allopathic system of medicine in the 19th century, where alkaloids of the herbal medicines are extracted and used as drugs. The interesting part is that the term allopathy is itself of Greek origin. Definitely, they also contributed a lot in different fields like emergency medicine, surgery, and diagnostics. We are grateful to them for their efforts. So this is all about the history of medicine in short. Hope you enjoyed this short journey of your history. Now I want to discuss with you the present status of Unani system in our country, India. There are a lot of Unani colleges and hospitals giving smart training to their students and treating patients ailing with chronic diseases and lifestyle-related disorders, such as type 2 diabetes mellitus, hypertension, liver diseases, to name a few. This calls for a special mention of my own alma mater, Ajmal Khan Tibb-e College, Aligarh Muslim University, Aligarh, India, which is one among the top colleges of India. As far as the practice of Unani medicine is concerned, India is one of the leading countries in the world. With the support of our Indian government, the Unani system has been scientifically developed, nurtured, and systematically integrated into the healthcare delivery system over the years. Our government has established top quality Unani research centers where each and every medicine is scientifically tested and also clinical trials are done. Drug manufacturing companies like Dawakhana Tibb-e Aligarh, Delhi Naturals, New Shama, and Hamdard, etc., are producing excellent quality of Unani medicines, making it easy for the practitioners to prescribe medicines. I, as a member of my Unani fraternity, would love to invite suggestions regarding the global growth of this system and the extension of health benefits to those in need. And I also think in my own little capacity that this can act as a catalyst in controlling and preventing innumerable body ailments. Here, I have my own inputs related to drugs, which can be either single drugs, which are dried herbs, or compound drugs in the form of tablets or syrups, which are more comfortably consumable. I wish to understand what exactly and how exactly the related resources you have at your end. Keeping in view about the growing global interest, we, the Indians, are trying our best to promote it worldwide. When I came to know that even you as herbalists, like you are interested in Unanipathy, I was excited to interact with you. Special thanks to Rabia Saboor ma'am for giving me a chance to be here in front of you. Before I leave, I have a very brief overview of the fundamentals of the Unani system of medicine. Mode of treatment included in Unani Tibb are Ilaj bil Ghiza or dietotherapy, Ilaj bil Adviya or pharmacotherapy, Ilaj bil Tadbir or regimental therapy, and Ilaj bil Yad or surgery. For better understanding the Unani Tibb, one should understand the concept of humoral theory given by Hippocrates. In our classical literature, body fluids or humors were termed as akhlat. Humor or akhlat is that fluid of the body in which our ailment is transformed. Humoral theory believes the presence of four humors in the body, that is, blood, phlegm, yellow bile, and black bile. And all these have a technical terms in Unani medicine, which is mentioned here in the slide. Humors are produced after the metabolism of food material. All the body fluids are included in those four humors. The second very important concept in the Unani system of medicine is temperament or mizaj. The understanding of temperament is based on heat, cold, moisture, and dryness, the combination of which describes each individual's unique constitutional makeup, including personality traits, physical appearances, and disease predispositions. In combination, there are four types of temperaments: hot and dry, hot and wet, cold and dry, and cold and wet. For treating any disease, one should keep in mind the temperament of the patient, temperament of the medicine, temperament of the environment, and the temperament of the disease. The importance of temperament or mizaj can be understood by a famous quote of Hippocrates.
We're at Payne's Prairie and we saw the
It is more important to know what sort of a person has a disease rather to know what sort of a disease a person has. Hello, are you saying something? Okay. So we all are aware that Unani Tibb has adopted a holistic approach to the management of disease. According to the concept of Unani Tibb, lifestyle disorders, example, type 2 diabetes mellitus, hypertension, obesity, etc., arise due to imbalance in asbab-e-sitta zaruriya, that is the 6 important essentials. And these are atmospheric air, food and drinks, rest and physical activity, psychological activity and repose, sleep and wakefulness, and elimination and retention. In the ancient literature, Unani doctors have shown great emphasis for establishing homeostasis between temperament and humors of the body, and this is all due to a proper balance between these 6 essentials, which leads to a healthy mind and body. Okay, now this topic is too big to be over in a single session like this. I end here and also welcome topic related queries or doubts. And I'll be more than happy to interact and solve them if I could in my capacity. And I'm also available for anything related to my area of expertise. For any kind of guidance, please feel free to contact me. Thank you very much for listening to me so patiently and giving me your valuable time. Thank you.
Alhamdulillah. Thank you so much, Dr. Raiha. Sorry for the difficulties. If anyone has any questions they'd like to ask, and unmute yourself and information that you'd like to know about. I see, like, Fatima, you're there. Fatima Bibi, are you interested? The other person that I know.
Oh, I am interested in further study. I had a little difficulty getting in and out here, but I'm very interested in hearing more about additional training.
Alhamdulillah. So did you have any particular questions for Dr. Raiha, who so generously gave us of her time today?
She did. She did. And I thank you so much. It's very informational. I don't have any questions at the moment.
All right. Well, thank you for coming in and
Thank you.
participating.
Thank you so much, Doctor.
Okay, but I come across the question very frequently, which I would like to answer. That someone asks, sometimes the people ask me that why Unani Tibb is of value in these times. The answer to this question is that because Unani medicine is very effective in treating various diseases and chronic ailments without any adverse effects on vital organs, even if taken for a longer period of time. And furthermore, it can successfully cure many ailments where surgical intervention is required, like uterine fibroids, renal calculi, cholelithiasis, hemorrhoids, and many more. Also, as you know, all know that COVID is still a major cause of concern, as there's no cure for it up till now. But good news is that Unani medicine can effectively treat this disease. Thank you.
Thank you, Dr. Raiha. I will spread the information. People have messaged me and told me they had doctor's appointment, they couldn't get in, they have various difficulties, but there still wouldn't have been a whole great deal of people apparently. But I will put the information in the chat and inform them and then let them know about your wonderful offer. And again, thank you for your time.
Okay, thank you so much.
Okay. If you get the recording, post me what you have recorded because I don't have all of it because I gave it to you. And yeah. Yes, Fatima, I'm sorry.
I'll give you the recording. You can share it to your friends, inshallah.
Yes, yeah, and I'll share what I have recorded, the part that I have recorded with you as well. I hope that we can do this again. I hope the low turnout was not a discouragement to you. They'll get the recording, so I think that will pique their interest more because it's the weekend and people shop, they do things on the weekends, you know. It's hard to get everybody all together at one space. But you had a very interesting share, and I really greatly appreciate your time and sharing with us. Thank you so much.
Okay,
and I wish you all the best in your effort. Alhamdulillah. Okay, I'm gonna make a dua before we sign off. We open with Fatiha, close with Wal Asr, inshallah.
Who Fatima ma'am is going to recite the dua?
No, Fatima, no. I asked you if you were going to do it. Will you recite for us? No?
Yeah, I wish that the program should end with dua.
Yes,
Inshallah.
go ahead.
You're asking me?
Yes. No? You don't want to? Okay. Shukr alhamdulillah for the time that we spent here today.
I just want to say,
Jazakallah.
I just want to say, wa akhiru da'wana anil hamdulillahi rabbil alameen.
Ameen. It was a wonderful opportunity for most of us, and for me, a special opportunity. And I'm grateful to Allah for putting us together. And I hope that this is not the conclusion of our collaborations, so that most people will learn about it. And I totally agree with you that there was a need for Unani medicine here, and that if people learn it, they will be able to use it to their advantage. But shukr alhamdulillah for allowing this to happen, to take place. May we have many more encounters with much more participation. And jazakallah for everybody that came. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم اللهم صل على سيدنا مولانا محمد النبي الأمي وعلى آله وصحبه وبارك وسلم عليه. All right, that's all I have to say. Shukran. Okay. All right.
Assalamu alaikum.
Wa alaikum assalam barakatuh.